Our resident doctor, Dr. Zach Levine, is back, of course, from the MUHC. I was just giving him a hard time because of my horrific experience at the Children's, but that's not your fault. You are not responsible.
We do our best.
You do your best, yes. But we love having you here. We're talking about, of course, it is that time of the year. Spring break's coming up. Everyone's traveling. My family and I are about to travel as well. So tips to keep in mind to keep yourself healthy, to have it be a good vacation. So we brought a bunch of tips for us. We're going to go through them all, or try to. Plan ahead. What is it? What do you mean by plan ahead?
Well, there's a number of things. Number one is see your doctor.
Yeah.
You know, I mean, especially if you have health conditions, but in general, it's a good idea to see your doctor. And think about it beforehand, because if you're going somewhere really exotic, like off the grid sort of thing, Africa, and you need certain vaccines, like yellow fever, there's a bunch of them. Some of them take several weeks to take effect. Yeah. So you should be going at least a month before.
Yeah, there's the tropical disease clinic at the MUHC, right? Yeah, it's very important to check that out and ask your doctor if you need those shots, because you may think that you don't need things like malaria pills, etc. Those things can kill you.
Absolutely, and there's a whole bunch of things, right? I mean, there's a whole list, and it really depends where you're going. So if you're going to Africa, it's much different than if you're going to an enclosed resort in whatever, Mexico or the Caribbean. So it really depends where you're going. And if you, I mean, a lot of information is available online and give you some idea. It doesn't replace going to your doctor, but it can give you an idea of what you're worried about wherever you're going.
Correct. I mean, and we're saying this knowing that most of you don't have doctors, so try to get a doctor is the step one, right?
And there are travel clinics as well.
Travel clinics as well, very important. Another alternative. Your next point is things to think about when you're traveling to countries, as you just mentioned, the Caribbean, Mexico, U.S. for the spring break, right? So what are some of the, traveler's diarrhea is still very much an issue. And in smaller kids, by the way, can be very, very dangerous, right? Talk to us about that.
Well, the thing is about smaller kids, I'm no pediatrician, but they can dehydrate faster. You know, their body of blood is less, their fluids are less. So, you know, if they lose a lot of fluids, it's quicker for them to become very dehydrated. And so it's very important for them to be able to get enough fluids in. And so that's why traveler's diarrhea is really rampant. You know, it's almost everywhere, and especially Mexico and the Caribbean and anywhere you go. And so basically you have to think about it ahead of time, and what do you need to do? So you have to drink bottled water, ideally. You want to eat things that are cooked, so well cooked. Things that have been frozen. Freezing does not actually kill the bacteria.
No, it doesn't.
No. So you want
the ice, by the way, in the water.
Ice, exactly. The ice can be contaminated. You know, so any of the water that they get just out of the lake or whatnot can be contaminated. And so you have to be thinking of ways to have bottled water, and also fruit. Ideally, it's fruit that you peel yourself. Right? Nothing that, so things that are washed.
Even when you're brushing your teeth, by the way, that's a big one too, eh? Like you don't even think about it. So anyway, bottled water should be available. And this is a big one, by the way, because when I was pregnant and when I came back from the Dominican Republic, the Zika virus was announced there. I had a horrific pregnancy. Zika, by the way, is something to be talked about with your doctors, and because a lot of the stuff is still unknown, right? So if you're planning on having a baby or becoming pregnant, they say avoid it for wait a few months before you come back. Are the tests for Zika now is it easier to get tested now? At the beginning, there was a sort of a backlog. Are we able to get tests?
I think the tests are more accessible now. Right. Certainly, it's out of the media spotlight for sure, but it's not out of the scientist spotlight. So people are still working on it. And the main danger definitely is for pregnant women. I mean, that's number one. So if you're thinking of getting pregnant, if you are pregnant for sure,
avoid.
You have to avoid it.
Yeah, it's nothing is worth a gamble. Okay, staying well en route and coming home. Part of this is air travel. Right. And what happens on the plane? It's a bit of an incubator.
It's definitely, so any, like any office is an incubator, any enclosed space is an incubator, so you share germs, right? And so the plane is one, and so you have to, do your usual things, so wash your hands, right? Wash. So, and even if you're not washing your hands, be careful not to bring them to your mouth or to your nose or to your eyes. You know, if you happen to touch a door handle, a lot of people like to bring that hand sanitizer. That's a good thing.
I love, like, everyone laughs at me for my obsession with the Lysol wipes, but I think that's okay.
Oh, yeah, it's okay. I mean, it's better to be laughed at than to get sick.
Exactly. Laugh all you want, Derek Fage. I love my Lysol wipes. So, but seriously, carry sanitizer.
Yeah, carry sanitizer. There are definitely other things as well in that incubator. I mean, one of the things is the oxygen level decreases. It's like being at a very high altitude. So people can, especially people with heart and lung diseases, can feel short of breath if they exert themselves, but also they can get a little foggy. It can make them feel quite tired. There's a risk of blood clots, as you may know.
Move around if it's a long flight, right? It's always important to move around to get your blood flowing.
Get up.
Dr. Zach, all of this, of course, is going to be available on our website, where your blog is as well. I mean, we've turned you into a blogger, and I love it. Dr. Zach Levine, thank you so much for joining us.
Thank you for having me.
I'm sorry I gave you a hard time about something that wasn't your fault, the Children's Hospital.
I hear you.
Hey, we'll see you very soon.
Very good.
All right, stay tuned. We're going to be taking a look at the weather and the traffic. It is